right, so this next video is going to be about breath and kind of calming the nervous system. So think about the parts of the nervous system that are connected with our vital organs, like heart, lungs, our digestive tract. So we think of it's known as the autonomic nervous system. So most people are familiar with the sympathetic nervous system, which is tied with fight or flight response, usually stress, tension, anxiety, and that. Usually that gets blood pumping to your muscles and away from your digestive tract, because if you had to flee or fight, you want to have the muscles ready to go. It also is tied in with alertness. So when you're really, really awake, or if you're on some kind of stimulant like caffeine, nicotine, or something stronger, it may make you feel a little more anxious, jittery even, or stressed if your body's undergoing too much of that. So to counter that, we have the parasympathetic nervous system, which is more rest, relaxation generally. And it's important to note too that there's a nerve that comes out of your neck. It's on both sides, known as the vagus nerve, that comes from your brain stem essentially. It's a cranial nerve, but it's a long nerve. In fact, the name vagus refers to the wanderer. So it kind of meanders its way down and connects to all those vital organs all the way down through your digestive tract. So if you have digestive issues, that can be linked to that as well, because things are not running smoothly or balanced. It can disrupt that, and also tie in with heart issues and breathing issues, which, as you can probably hear right now, I'm having some of those, seemingly allergy related, but all the same, if you're not breathing well, it can make you feel pretty uncomfortable and anxious and stressed. So you want to try to regulate that as much as possible. So I'm going to put my feet flat on the ground here. I'm going to kind of root myself. I'm going to make my oak tree here and kind of nice, sturdy, pull in that core, open up that canopy. But I kind of want to relax into this because I want to stimulate that parasympathetic to balance out any imbalances there, okay? So I'm thinking about, I'm trying to control the tempo of the radio station of the music in the background. So if I don't like the music, I can kind of change the station. That's the benefit of being able to control our breath. Just have to use a little mindfulness and kind of focus on that. Speaking of focus, what we can do here is kind of maybe even close the eyes so we're not getting too much input in there, so we can kind of give more attention to what we're feeling and the breath. And then we're going to tie in some of those visual things as well that can help, whether your eyes are open or closed. Maybe in through the nose, out through the mouth. You can breathe through your nose. Okay. But just trying to calm things down, balance things out. I want to have my head in a more neutral position. But again, those nerves in there, if they're hung up tight, maybe the scaling muscles in there are tense, they tie in. The scaling muscles tie in with breathing. So if your breathing's off, it can clamp down on the vagus nerve, among others, and cause some disruption there. Or maybe put my fingers just on the inside of the collarbones here, just to hold that, and I can kind of look up gently and away. Breathe the other way, look up gently. If one side's tighter than the other, obviously you can focus on that. Let that tension go, right? You want to free along the neck and keep that canopy nice and open, not scrunched and pinched, okay? So I mentioned the eyes earlier, so that's the other thing, is you can think about unfocusing your eyes. So there's some theories out there about, when we're focusing too much, which we oftentimes do with our phones or on the computer, things like that. It not only fatigues the muscles of the eyes, but it also tends to make us feel more stressed, maybe more anxious. So you want to imagine like a telescopic lens like above your head, and you're right now in your vision, but if you can just, whether your eyes are open or closed, try to imagine like zooming out. So if you're looking at a single tree in the forest, you want to zoom out and see the whole forest. So you just imagine that like a satellite zooming in on a target or something. It's going to zoom out, and you're just going to imagine like seeing whatever thing that's around you. So you're kind of shifting focus to the peripheral vision without over-focusing in what's in front of you. And again, you can do this with eyes closed. You might want to start with that because it just helps to unfocus if you don't actually have anything you're looking at. So just imagine what all was around you, and then just breathing and unfocusing and zooming out, but kind of keeping that posture. We don't want to collapse completely here because we don't want to scrunch, so we want to keep that open. And just practice like that. You can do this sitting, standing, maybe not standing if your eyes are closed, unless you're holding on to something, but lying down, but just to reset the nervous system and calm things down a bit.